Welcome to Inspire and Move, the show that inspires you to create, connect, and grow. I'm going to bring you meaningful conversations, aha moments, and all the motivation you need to up-level every part of your life. I'm Ali Aruda, founder of Inspire and Move, and your personal hype girl. I've gone from fashion school to celebrity stylist to corporate marketing to brick-and-mortar entrepreneurship with my husband, each time learning incredible lessons how to pivot, reimagine, and implement the steps to become successful. I'm passionate about inspiring others to live their best life, a life of joy. We have the power to design a life that we love, because life is too short not to. The best part is that you weren't meant to do this alone. If you feel like you are meant for more, let me ride shotgun with you, and together, let's get you to where you want to go. Hello, everyone. Welcome back to the Inspire and Move podcast. I'm your host, Ali Aruda, and today, not only are we coming to you from a different location in studio, but I have not one, but two very special guests. So I am coming to you today from Dermetics, a place that I love, and both Matt and I spend a lot of time at. And I am joined by the wonderful humans that have made this place what it is, Dr. Rosen and Dr. Muhn. Welcome to the show.
Thank you for having us.
Thanks so much.
You guys want to know something really cool?
Always.
You are the inaugural two men in one interview guests. I have never interviewed two men at the same time. How cool is that?
We call ourselves pioneers. That's an interesting one on the list.
The competitive side of me loves that. Where I was like, that's a fun fact I'm really excited to share with you guys.
Well, we better not disappoint.
No, you're not going to. We have so much good stuff to dive into.
Pressure's on.
And I can't wait to start the conversation. Where I would love to start is I love your story of how you guys not only have created this amazing brand and business together, but you guys have been friends for 28 years. And Dermetics had just celebrated not too long ago the 20th anniversary. Congratulations.
Yeah, it's a love story.
Yeah.
It really is. So I would like to start there. I would like to share with the audience, with the viewers and the listeners, a little bit about your love story.
Maybe not love story. We'll call it a bro story more
Bro
than
story.
anything. Although he does feel like a lifelong partner. But I'm from here. He's from Montreal. And at one point in time, I was doing my training at McGill in dermatology. And when I got there, he was in his end of his medical school. And so we would do rotations together. And at the very beginning of those kind of rotations, we worked together. And there was some hard stuff, right? It was like tough stuff, long nights, difficult cases, etc. And I remember like when we were first connecting, I said, this guy's got it. He's got humor, he's got honesty. He has an incredible, and even to this date, unmatched work ethic. And so we thought, you know what, we're going to start to get along. And as time goes on, he gets into dermatology, which at that point in time was very hard to get into. So he got into that.
Little feather in your cap. Congratulations.
It's a big deal. And we started to, work together over 5 years as well.
I just want to interrupt the story here and add my little piece. So when I was thinking about trying to get into dermatology, I went to Channy and I asked him for some help in terms of the application, and he had sent me his application. Mm-hmm. And I looked at his CV and I said to myself, okay, there's no chance at all for me to get into this program because like Channy's here and I'm over here.
No. Whatever. He gets in, we get in together. Okay, he gets in. And he's just respected so much. And over that period of time, and you'll notice through the course of today's conversation, if you give Nathan a compliment, he shuts it off. He's not good at receiving. Even 28 years later, he cannot receive a compliment. So watch closely and watch his face because it's amusing.
What's with this psychoanalysis going on here? I thought
so
we were talking
if we were to talk love languages, then you would not be a words of affirmation individual, Dr. Rosen.
No.
Now I just need
so.
to know, what's each of your love language?
No, as he gets older, he's a bit more affirming. No,
This is great. We could actually ask you, like, what's each of your love language to give and receive? Because I actually was just talking about this on a mastermind call yesterday, how I actually like to know that for everyone on our team in the business that my husband and I run together. And it's so interesting to understand that about your partners in life, in business, and as well as your team. So this is interesting. We can circle back on this at a later date, maybe offline.
Okay, perfect.
There's more to untap.
Well, some of what I'll say, like what I loved about him amongst those other things is part of his love languages. He's one of the most authentically honest and humble people you'll meet. And he can't tolerate, though, maybe to a fault, can't
How
tolerate.
this interview is going on?
Yeah.
Because this is like
compliments
really
but dishonesty and things like that. So when we're
I feel like I'm being ambushed.
So Fast forward story. Let's get more technical. I stay an extra year, do a fellowship in cancer reconstruction and cosmetic. I come back Burlington and begin practice. He does the same thing in a pretty elite program in Manhattan. And then we decide, we had made these sort of pipe dreams as boys in residency that we're going to work together. And then decision day, and he moves his whole family down here. Didn't know anybody, came here on a giant leap of faith because we sort of, and still do, have that same kind of belief that it's not just about patients doing well. I want him to do really well, and he wants me to do really well. And that kind of having each other's back has been one of the fundamental things about how we grew.
That's a really beautiful accolade for both of you to have that mutual respect and love for each other and the success of the business that you've created.
To date, we've not said love, so we won't. Today
Okay.
will not be the
I'm
first
going to
day
say
we
that a
say
lot.
love.
I have lots of love for both of you and the work that you do here. And just for context for everyone listening and watching, Dermetics is where I spend a lot of time for my own injectables, support with my skin routine, changing my skincare routine. I've been sharing that a lot on my content recently. So I just wanted to give everyone some context as to why both of these incredible humans and Dermetics is so important to me in my life and my wellness routine.
Thank you for that.
So you've created Dermetics, rewind like 20 years ago. What was your vision for what you wanted to create?
Well, when we started, I would say that our vision was really to create an all-encompassing skin health clinic where we had always the highest standard of care for our patients. And when we started, I would say we were doing a lot more on the medical end, but both of us, through our fellowships and even through our trainings, we kind of gravitated towards mentorship with physicians who were those who kind of did a whole plethora of different kinds of things. So doing traditional medical dermatology, but also doing procedures, doing skin cancer surgery, which we both did fellowships in, and then getting into aesthetics, which was kind of really at its infancy when we were kind of coming through. It was part of our training program, and that was a newer thing when we were training. And as time went on, and the way that medicine has changed so fast, how research has changed so fast, it starts to become a little bit hard to necessarily be the best at everything. And for both of us, I feel like that's really where we feel in terms of values that we want to be able to absolutely deliver, the best care for our patients. And things have started to sort of become a little bit more refined in the aesthetic realm, where again the advances have been fast and furious, and techniques changing and technology changing. So that's kind of become our focus at this point.
I think that really speaks volumes to how you operate here at Dermetics and your commitment to science and research and excellence. And you've seen thousands of patients over the last 20 plus years. What is it that you see in terms of trends that have changed over, let's call it 5 to 10 years?
Well, I think as our abilities and our understanding have changed from the people who deliver the treatments and results, so too is the language of the patient. So when they first came in, it was about fixing a defect, a line, a frown. And that was okay at that point in time. But the more we learned over time, the more that we understood how the face moves and behaves, etc. I think, and people are much more educated now, a lot more sophisticated, social. Like, I mean, you're a wonderful educator. And when patients are educated, they come in understanding a lot more. So a lot of it's now about wellness. There's a bit of a catchphrase out there which needs to be sort of debunked a bit when people say natural, because cyanide's also natural, right? Like, so
Natural, but with like some
yeah,
support.
yeah. So, but again, being natural, and so the desire to look well and be well, I think is what you find with the majority, which is really right up our alley. It's hard for us to treat people who we don't align with, and it's an important delivery for us.
Yeah, I'd say trends. I think are maybe sort of short-term ways that society decides things are maybe like good or more advantageous, and they tend to kind of go through cycles. So trends don't necessarily last, but I would say that beauty or wanting to look good and feel good, I don't think are ever trends. I think they're kind of time tested, tried and true. And those things I think have been consistent, and the essence of beauty is really consistent. And I think that that probably also sort of is more a matter of the evolution of mankind over thousands and thousands of years, right? So
It's getting
those are
deep.
staples.
I love it.
It's going deep.
Well, I want to go
Yeah,
in the route of longevity and anti-aging
yeah.
because at the time of recording this, I am 39 and I love when people think that I'm in my 20s. I actually recently got ID'd when I was in the US and I was like, God bless you. You get an extra tip for thinking that I was not even maybe 21. I go to Dermetics. That's why.
And
So,
here's my credit card. You can have
yes,
them.
and here you go. And add extra tip. So let's chat longevity and anti-aging because that was something I was excited about. I'm relatively novice in the world of Botox. It's been about a year, maybe a year and a half since I started that addition to my beauty routine. And when someone had told me years back that it's actually a form of anti-aging and longevity and how you can age gracefully, I would love to go there and chat about the relationship of injectables and longevity and aging gracefully.
Yeah. So in terms of aging, basically, if we're talking about the face, the way we like to explain to our patients about the process is that there are basically like three big silos where we're aging. So one of them is in terms of movement-based changes. So our muscles are always moving, facial expressions, and we have treatments that are really sort of meant for that kind of silo. And that would be more like Botox for that, those movement-based changes. Then there's a lot of structural changes. So we have changes in our bone structure, we have changes in the fatty tissues. And so we start to kind of actually like reabsorb some of that bone and lose some of that fat. And so we lose structure, and then the skin envelope becomes almost like too big for the container and things start to kind of sink and sag. So we need structural support for those changes. And so materials that will fill will then be good for those types of changes. So fillers or fat, those would be things that would help the structure. And then there's skin quality changes. So we might see changes in tone, different colors, brown spots showing up, more broken blood vessels. We might have roughness to the skin, dullness to the skin. And a lot of that is also just based on environmental stimuli, particularly sun, but other things as well, and just chronology. Those things change the skin quality. So for those kinds of things, we use our skincare and we use technologies to try to generate new collagen, protect the skin, protect the breakdown. So if you're talking about like longevity, we need to sort of look at all of those silos and make sure that we're paying attention to each of them individually in that patient to make sure that we are on top of things, that we're preventing those changes, and that we're stepping in early so that we can then have a much sort of smoother, less dramatic change over time.
I love that. Is there a certain age where you would recommend people start incorporating things like Botox, filler into their routine, or is it really an, individual basis?
I mean, everything's individual from day one. But if you asked that question 10 years ago, I was like, well, young people in their, how old are you? 21, 22
Yeah,
is what you got started?
exactly. That's exactly right.
That's too early, would have been the language 10 years ago. But more and more we move to sort of chronologically what someone sees, what their interests are, how much they want to do to try and look well during this process. We use the word anti-aging, and that's not really been studied in that context. We know definitely there are protection factors that happen and damage of skin, telomeres, like all sorts of things, like glycosylation, all these things that happen within skin and body. But true anti-aging, that's hard to prove. I mean, I think the closest one we had, Nathan, was that binder study, right? Like way back when, and I think there was, I think these two twins, I believe they were California, I may have the place wrong, but for like 13 years, that one twin got every 2 or 3 months Botox of glabella, forehead, and sometimes crow's feet, and the other one only did it twice in that 13 years. And when you paired them side by side after these 13 years, that first twin had no ingrained lines, no big lines anywhere else, but areas where they both didn't get treated, like the folds, they were equal in their aging. So there was some evidence
Interesting.
of that, but that's kind of as close as we've seen in something that's like scientific that says that there was stuff. We hear it all the time that people, they have less lines as they get older. I mean, there was that one sun damage case, just to Nathan's point. There was, what was his name? Bill McCall,
The
the
truck
truck driver,
driver.
who had sun exposure on the one side of the face. And it wasn't AI or a Photoshop. His one side of the face, left side of the face, looked very aged and the right side didn't, because people respond differently. Like Nathan pointed out, to environmental factors. We talked about sun. There's more and more evidence about pollution. There's a huge body of coming evidence that talks about inflammation both on skin and internally. So all these things pour into that longevity piece. They make our lives exciting because you really need to stay on top of sort of the literature. You have to stay on top of the things that we offer for patients, because there's a crossover between them. The things aren't in isolation, right? Like the face doesn't age in isolation of the body, as an example, or someone's wellness, right?
Sure, yeah, I totally agree. And it's really it's always individual, but like, I think these are legitimate questions in terms of like how soon do you start? And then it's the answer is also it depends on what you're talking about in terms of the procedure, right? Like in terms of skincare, we know that there are really young people now who are going on like these 12-step skincare regimens that are probably way in excess, when just some sunscreen is probably sufficient for those kids. But then you might have someone who is very active, acne prone, and then using a retinoid is very helpful for that problem, and would also technically have some types of other benefits that you're getting at the same time. When do you start injectable treatments? You might have someone who just genetically has, something in terms of their structure that puts them at a big disadvantage in terms of aging. So if you're able to sort of restore the structure, they might not only feel better about their proportions and the way they're looking, but they might actually be preventing their aging in those circumstances. And this is something that we're looking at right now in terms of our patients, and we're trying to collect permission from patients who we've had for like a decade or more. And we're going back to their first photos and patients who have like adhered to plans that are holistic plans, and looking at them now and comparing them to their first picture. And it's quite remarkable, actually, when we sort of look at this and we see how negligible the changes are in those patients who are doing these procedures. So I think
Now,
more and
you mean
more,
like aging changes?
yeah, they're not aging. It's like 10 years older, but looking 5 years younger than that first day that they showed up. So our feeling is that these things are very powerful, actually, in terms of being able to prevent aging and the longevity, the health span of the skin.
That's like the Dermetics Benjamin Button effect. It could be like a little
Maybe.
subline.
I mean, it is consistent though in the patients that we follow. We've been around long enough that we get to say that, right? That we've
Well, for
had
sure.
patients over X number of years.
Okay, so on the flip side, when we talked about, it's starting age can vary depending on many factors. Is there on the opposite side a cap where you might tell someone like you actually might be, I feel sort of bad saying, like quote unquote too old to move forward with some of these silos, to Dr. Rosen's point, if they wouldn't be as effective because they have lived so many lives and different barriers of entry with, sun damage and stress.
I think it's the same as what Nathan said when he was talking about that younger population, about um, genetics and what that genetics looks like when you're facing that patient. So we have patients lots of patients, and sort of who would people consider elderly, who are coming for treatments, getting wonderful treatments and results. Our approach changes a little bit, our dosing changes a little bit, and the way we try and keep someone well and healthy changes a little bit as well. But those things, I think, I wouldn't put a cap on the age. I mean, I have some patients who I hope to get to that age.
Yeah, and I would say like there 100% there's limitations to what we're doing, and our inclination is that a lot of what we're doing is so helpful in prevention. So there is that essence where getting in maybe a little bit early is probably, or earlier, makes a lot of sense. If we have people, though, who we don't feel are going to get sufficient benefit from the minimally invasive types of procedures that we do rely on surgical colleagues, if that's something that the patient is open to be able to have a more impactful result. But there are also people who are looking not necessarily to totally reverse what's wrong, but to have a little bit of improvement, and that gives them a lot of satisfaction. So even though you might not, if you're looking at their sort of before and after photo, feel like there's like a massive difference, people sometimes get a little bit hung up on small small issues, and we're able to give them more confidence and make them feel a lot better about themselves with what we do as well.
I love that. And Dr. Muhn, I wanted to circle back on one thing that you mentioned when we were talking about the truck driver study. You just mentioned the word factors, and that was one thing I wanted to come back to. Are there additional factors such as stress, nutrition, sleep,
For sure.
active lifestyle that can impact the aging process of our skin?
No, literally, you just named them,
Oh,
right?
great.
The
Are you
human.
hiring?
Yeah, yeah,
Should
you're
I
done.
come join the team?
Yep, you can take over my job. The,
Respectfully, I won't do as good of a job as you will.
I doubt that. I think you'll surpass us as you always do. But recently there's a term in our industry called an exposome. So things that you're exposed to affecting the viability of whether it's your joints, your skin, your organs, your general health. And all of those things that you mentioned in various ways have impact. Of course, environment. Of course, the amount of stress. I mean, stress changes many, many things from your hormone supply, the way your rhythm occurs, your ability to rehabilitate, recover. Like that's just from one aspect. You add things like nutrition, and Nathan's very versed in a lot of these things too. The things that nutritionally that lower inflammation will help you. Things that change the way that sugar is hitting the body, because sugar basically is like a sludge on every cell. So you put it on, it's an extra weight on the cell, and the cell just can't behave the way it wants to. So again, proper, good, useful sugar is very different than the kind of sugar that most of us are exposed to. Smoking, pollution, I mean, the list goes on, right?
It's really interesting because I come from a fitness background, and you think of how your body is going to perform, how it looks, aesthetically to the eye, that it's very aligned with everything that you're talking about in terms of our skin. And it's true, I believe I'm correct, that our skin is our largest organ. And so when we think about how we're going to feed the rest of our organs from a nutrition standpoint and managing our stress and how are we staying hydrated, all of that can be completely aligned with how we're caring for our skin.
Absolutely. I think that that's a fundamental thing is it's an organ. So
Mm-hmm.
it's acting in the same way as everything else in our body. So all of these things have huge impact. So being healthy is extremely important in terms of skin health as well. And it's interesting though to me that a lot of people though who are very, very set on body health don't necessarily pay as much attention to skin health.
Mm-hmm. Oh, I love that. Dr. Moon, before we go anywhere else, do you have any thoughts to add to that? Because I think that's a great thing that Dr. Rosen just shared.
Which part about the lack of correlation between people
Mm-hmm.
who are very, very fit and the lack of care on skin? It's an interesting cohort. There's a lot of people out there who work on body health, but everything from skincare, sun protection, um, those things, there seems to be a disconnect, right? You feed the body, but and believe that that's going to get to the skin if you care. It probably doesn't all make it to the skin. There's that portion, and then there's the other part about people who are very fit, and we're in a world of like semi-glutides and weight loss, et cetera, where a lot of fat loss happens, and
Mm-hmm.
we know that even people who are very, very healthy, sometimes we lack, not we, sometimes they
Yeah.
lack a lot of facial fat, and fat has an important role on the face. It modulates things, it protects, it's a barrier. Muscles behave differently within fat, right? So there is that certainly whole cohort for sure.
That poor word fat, it gets such a bad rap because it's so important in our diet. Something like walnuts and avocados, those are important foods for us and they have a purpose in our nutrition and how that's going to help our body perform and our skin and everything. And it just gets such a bad rap. Okay, so I want to dive into the world of injectables. I feel like this is where people have just sort of like turned up the volume as they listen to this because I want to get right to the tea about injectables and, what looks good and what's too much because I think that I mean in what I have lived of my life, I have seen some work where I was like, wow, that's very full. And one thing that I really love and respect so much about what the Dermetics difference is in your approach to the world of injectables is the look that when people like my face, for example, people will look and be like, wait, you have filler, you have Botox? And I am very proud to say, like, yes, I do. And I love how the work has been done because it's not obvious and that it's almost this surprise and delight for when people, when we start opening that conversation. And I think it's also something that some people aren't so comfortable talking about, like politics, money, religion, and injectables. But I love talking about it, and I would love to have a conversation with the two of you who
Sure.
are experts in it of what's working right now.
In terms of injectables, what's working right now? I mean, injectables have been such a tremendous evolution in aesthetic medicine, really just quite incredible in terms of what can be achieved with very little risk and very little downtime. So, I feel like I'm so bullish on like Botox as a treatment. And I feel like fillers are also an essential treatment. So just going back to kind of like those silos, these are the mainstay of treatment. And unfortunately, a big negative trend has been how a lot of people are influenced by social media, and social media is really about trying to get clicks and be bold and be controversial, or be very exaggerated and extreme in claims and what's happening. And we felt like that has been like a huge change in our practice. So it takes us a lot of time to educate our patients about what the truth is versus what a lot of the myths are. And there's nothing that's all good or all bad. So there's always a potential for side effects when you're doing treatments, and there's no one who can do treatments without getting side effects. But there is so much to gain for very little, risk when these things are done right by the right people.
I love that. Dr. Muhn, do you need
Well, it's
anything
just
to add to that?
the term injectables is a beautiful one because I mean we categorize them traditionally into things like neuromodulators. That's a category of Botox and Dysport, and I mean there's several brands, that Xeomin, and those are the language that's out there. There's that one form that was the original game changer, right? That helped people understand that when you shape and protect and change the way that the muscles look, that you can have someone who looks well and look healthy. So that was the original. And then we got into this whole category of fillers, and fillers themselves have had a very interesting history over time. You remember we have these ones that have lasted most of the time, which is hyaluronic acids, and there's different kinds. But there was a time where people were injecting collagen, and you remember like the artificial, like almost plastics into the skin, which is a bit crazy. And then and they don't use that, or we don't use that. But and there's another category. They're called fillers, but we really categorize them as collagen stimulators. And sometimes, especially like Nathan pointed out, social media, TikTok, it has wonderful power, but it has also a viral-like effect in terms of spreading some things. And so lots of patients come in and say, well, I don't want to look stuffed. I don't want to, which is fair. I don't want too much filler, which is also fair. I only want these new collagen stimulators, which then becomes a problem because you can't necessarily manage everything with one. There's not one tool for everything. So like Nathan said, what we pride ourselves on is being very, very good at assessing a patient's skin. That's a skill that it's taken 20 years and we're still learning every day. And that's probably the greatest weakness out there, is that people can't assess people's faces and the things that led to that, what we're trying to treat. And then trying to educate people. When you do that, you go through, take away the trends like Nathan talked about before, take away the things that are there for 15 minutes in time. And when you go to that holistic approach, you still end up, these patients who come in who said, don't want anything to do with fillers, they're getting fillers and they really appreciate our approach of just enough or less is more, whatever, and looking like you do, like you can't tell, but you can tell that you look healthy.
Thank
Right?
you.
That's something, but that takes time, and it takes this authentic listening to patients and understanding what we're looking at. And so that's, I think, the thing that we've honed most outside of our injection skills over the last 20 years is just zipping it and listening, right?
Yeah, well, you definitely do a great job of that initial assessment. And I love that you document photos with all of the treatments so that you can look back and compare. I'm a very visual learner. So seeing my day 1 photos versus my, day 68 for me is very helpful. And I've really appreciated that part of my Dermetics journey. Thank you so much for listening. If you loved this episode, it would mean so much to me if you took a few seconds and shared this on social media, sent it to a friend, or left a 5-star review. There is power in community, and I'm so grateful to have you part of mine.